Listed below are 7 common drugs that have the potential to cause kidney damage. Medication is a part of our lives. While it does help us in some ways, it also has the potential to kill us without our knowledge. In this way, as we become older, our kidneys will not function as easily. It is critical to refrain from exposing kids to an excessive amount of pharmaceuticals and toxins. The fact that becoming older typically brings with it a plethora of health problems and additional medications to take makes it difficult. Certain drugs have the potential to be nephrotoxic, which means that they can cause damage to the kidneys either directly or indirectly. As a consequence of this, the kidney's capacity to filter blood gradually decreases and hazardous waste accumulates, which ultimately results in major health problems. The level of kidney damage is defined in stages, which range from minor malfunction to full failure of the kidneys over time. Having kidney diseases and getting older both enhance the likelihood that you will experience kidney damage as a result of medicines or drug-induced nephrotoxicity. Medication can cause kidney damage in 2 primary ways: dose-dependent toxicity and idiosyncratic toxicity. Both of these types of kidney damage are serious. In the case of dose-dependent toxicity, the extent of damage increases as the dose is increased. On the other hand, idiosyncratic toxicity is something that cannot be predicted and varies considerably from person to person. There are occasions when it is preferable to steer clear of these medications entirely. The breakdown of muscle tissue, also known as rhabdomyolysis, the death of kidney tissue, also known as renal infarction, and the accumulation of acid, also known as renal tubular acidosis, can all lead to drug-induced nephrotoxicity. The kidneys may work less effectively as a consequence of this, in addition to other disorders such as nephrotic syndrome or electrolyte abnormalities. In this video, we will discuss the effects that common medications have on kidney health and offer some helpful advice for appropriately managing these prescriptions in a secure manner. It is important to keep in mind that having an understanding of the dangers associated with them can provide you the ability to make educated decisions regarding your health care. Keep up with the latest information and discover how to save your kidneys while also efficiently addressing other different medical ailments. Before we get started, I would like to clarify that all of the information that you will see in this movie was created by people and is intended for humans. You can view our advisory board and the team that is responsible for these videos by going to our website, which is located at healthtoday.com. We do not make use of writing tools that implement artificial intelligence, such as ChatGPT, in order to automatically write articles. You may rest confident that our content has been properly fact-checked, is objective, and has been evaluated by individuals who are competent. When it comes to the medications that have the potential to cause damage to your kidneys, it is time to return to the medications. Antibiotics number 7. In spite of the fact that antibiotics are frequently administered, they are not risk-free. Are medications prescribed by your physician for your sore throat, skin infection, or any other ailment that you may be experiencing? In that case, it can be causing damage to your kidneys. To begin, let's explore the concept of antibiotics and what they are. Antibiotics, usually referred to as antibacterials or antimicrobials, are a class of drugs that are intended to suppress the growth of bacteria that cause infections. Either killing bacteria or by stopping them from multiplying, they provide the desired effect. Common antibiotics are available under brand names such as Cipro, Augmentin, Phalangeal, Bactrim, or amoxicillin. Examples of these medicines include: the use of these medications may be recommended for the treatment of skin infections, strep throat, pneumonia, urinary tract infections, also known as UTIs, or skin infections. These bacterial diseases can be treated with antibiotics, but viral infections, such as the common cold, the flu, bronchitis, the majority of coughs, and the majority of sore throats cannot be treated with antibiotics. Therefore, you want to use extreme caution whenever your physician recommends antibiotics to you. If the medication is not prescribed correctly, you may encounter adverse effects such as diarrhea, as well as problems with your liver and kidneys. It is possible for certain antibiotics, such as polymyxins, aminoglycosides, and vancomycin, to cause damage to your kidneys even when they are administered appropriately. To put it another way, your kidneys are responsible for the elimination of substances like antibiotics and other medications from your body. Be wary, however, because antibiotics such as polymyxins have the potential to harm the membranes of kidney cells, which could result in kidney damage. Similar to the last antibiotic, imazoglycosides have the potential to accumulate in kidney cells, leading to the death of cells and causing damage to the renal tubules. In general, the mechanism by which each antibiotic produces kidney injury is still not entirely understood. Nonetheless, it is possible that it involves inflammation and damage to kidney cells. Antibiotics must be administered in the appropriate manner in order for them to be both effective and safe for the health of the kidneys. Did you know that over 1/3 of the antibiotics that are administered in the United States are not even suitable for the illnesses that are being treated? According to a study that was published in the Journal of the American Medical Association, as well as a report that was issued by the Centers for Disease Control and Prevention, also known as the CDC for short, this is the case. Prior to requesting an antibiotic, or if your physician prescribes one, it is essential to have a better understanding of the illnesses that antibiotics can cure. You might inquire with them about the necessity of this. In addition, the majority of medical professionals will gladly explain the necessity of it. When antibiotics are actually required, it is imperative that the dosage be taken precisely as directed and that any dietary restrictions be adhered to. Even if you feel better, you should never save medicines for later use or give your prescribed antibiotics to someone else. This is because prescriptions are suited to the specific health preferences and requirements of each individual patient. Up to this point, are you enjoying our video? In the event that this is the case, we would appreciate it if you could provide us with some hints by clicking the like button. In a nutshell, there are 6 non-steroidal anti-inflammatory medicines, also known as NSAIDs: ibuprofen, aspirin, Motrin, ketorolac, Teladoc, Subi, and naproxen are all examples of non-steroidal anti-inflammatory drugs. Some people may not be familiar with these medications, but do you know what they are? You can buy some of these without a prescription, and yes, they are all non-steroidal anti-inflammatory drugs, NSAIDs. NSAIDs are, in point of fact, quite widespread. Every day, more than 30 million people take them. NSAIDs are frequently prescribed to patients suffering from headaches, sprains and strains, colds and the flu, as well as discomfort caused by arthritis. NSAIDs were mostly effective because they inhibited the activity of an enzyme known as cyclooxygenase, or coxin for short. This enzyme contributes to the production of chemicals that cause pain. But in addition to this, COX is essential for shielding the kidneys from the effects of stress and for assisting in the regulation of salt and water excretion. Therefore, the fact that non-steroidal anti-inflammatory drugs, NSAIDs, block COX is a significant reason why these medications can cause damage to your kidneys. Acute kidney injury, often known as AKI, can be caused by any non-steroidal anti-inflammatory drugs, NSAIDs, particularly in elderly patients when taken in excessive amounts or over an extended period of time. There are 2 primary manifestations of this damage. The first reason is that blocking COX can restrict renal blood vessels, which in turn reduces blood flow. The second reason is that inflammation is generated by blocking COX, which is the source of both types of inflammation. Because of this, it is possible to experience fluid retention, high blood pressure, and even a small temporary impairment of renal function. It is possible that if this is not addressed, it will lead to more serious problems such as acute tubular necrosis, which is a condition in which kidney tubules die as a result of a lack of oxygen, and acute renal failure. In spite of the fact that this may at first appear to be acute renal failure, it may gradually develop into chronic kidney disease. The second point is that although nonsteroidal anti-inflammatory medicines, NSAIDs, or anti-inflammatory pharmaceuticals, might cause inflammation in the kidney tubules, which are the minuscule structures that filter waste, this inflammation is quite uncommon. But kidney problems that are caused by nonsteroidal anti-inflammatory drugs, NSAIDs, are a major cause for concern, as they affect between 1% and 5% of people who use them on a daily basis all over the world. A kidney damage caused by nonsteroidal anti-inflammatory drugs, NSAIDs, affects around 500,000 to 2.5 million people annually. Moreover, these medications frequently result in adverse drug events, some of which can be fatal, which lead to hospitalizations. This is a significantly more serious issue. The Journal of the American Society of Nephrology released a study in 2006 that reviewed data from more than 10,184 individuals who were prescribed nonsteroidal anti-inflammatory drugs, NSAIDs, for a variety of diseases. It was found that the use of nonsteroidal anti-inflammatory drugs, NSAIDs, increased the risk of acute renal injury by 26%, particularly within the first 30 days of use. This finding highlights the importance of exercising caution when prescribing and carrying out the use of these drugs. The researchers looked at 99 patients who had persistent musculoskeletal pain and had been taking nonsteroidal anti-inflammatory drugs, NSAIDs, for a period of 1 year. When they switched to a different pain reliever medicine, they discovered that the majority of patients' kidney function returned to normal after the usage of nonsteroidal anti-inflammatory drugs, NSAIDs. If you are interested in the evidence, here it is. You may find the links to the research that back up our assertions in the description box that we have supplied with. Nevertheless, the following group of medications on our list might come as a surprise to you because, in general, they are thought to be very beneficial for your kidneys. There are 5 diuretics. When it comes to problems such as fluid retention or edema, which are frequently observed in heart and renal failure, as well as liver cirrhosis, diuretics are beneficial. There are some diuretics that may be purchased without a prescription, but the majority of the time prescription diuretics are more potent. As an example, hydrochloric otitis Z, sometimes known as HCTZ, is a common diuretic. Faraz furosemide sold his Lasix-Spire and a lactone that was identified in L-Tech, tone, and acid as dolomite and Diamox. Boom! Actinide and Bombix is also included in this list. They accomplish this by boosting the amount of urine that is produced. Moreover, they are beneficial for the elimination of excess salt and water through the urine, which can be of assistance in the management of hypertension, also known as high blood pressure, which is a primary risk factor for kidney disease. When it comes to your kidneys, diuretics are generally considered to be safe. Diuretics, although their general favorable effects, are not without potential side effects, particularly with regard to the health of the kidneys. Unlike nonsteroidal anti-inflammatory drugs, NSAIDs, they do not cause direct harm to the kidneys and do not interfere with the kidney's ability to filter blood. Instead, They make their presence known farther down the kidney's process, where they affect the concentration and makeup of the urine. Because of this, the volume of urine that is produced or the levels of electrolytes that are present in it can alter. As a result, excessive use of diuretics or high doses of these medications can lead to dehydration, which is a risk factor for kidney injury. In a study that was conducted between 1999 and 2010, 131 patients who were taking diuretics and had acute renal injury were examined in a medical facility. By the time they started using diuretics, 96.2% of the patients already had at least one health problem, with chronic renal disease, often known as CKD, and shortness of breath being the most frequent conditions, accounting for 55.0% of the cases. In their study, the researchers discovered that individuals who used diuretics had greater rates of kidney disease and the risk factors associated with it, such as diabetes and hypertension. If the dose is increased, the risk will also increase. Additionally, 27.5% of the instances of acute kidney injury were brought on by diuretics by themselves, while the remaining cases were brought on by a combination of diuretics and other medications. Therefore, before beginning any new drug that contains diuretics, you should always see your doctor. People who have chronic renal disease and are taking diuretics should be sure to drink plenty of water and evaluate their kidney function and electrolyte levels on a frequent basis. Over the past few decades, there has been an increase in the number of home testing choices accessible. It is now possible for individuals to assess their kidney function without leaving the convenience of their own homes. When it comes to proton pump inhibitors, also known as PPIs for short, are drugs that are commonly used and may be purchased without a prescription. In order to effectively treat illnesses such as gastroesophageal reflux disease, also known as DIRT or acid reflux, these medications work by lowering the amount of acid that is produced by the stomach. The reason for this is because proton pump inhibitors, PPIs, target an enzyme in the stomach known as hydrogen potassium ATPase, ATPase, which plays an essential role in the process of acid secretion. Even though proton pump inhibitors, PPIs, are typically safe and are excellent at relieving acid-related discomforts like heartburn, they nevertheless have dangers, particularly with regard to the health of the kidneys. An example of this would be the fact that proton pump inhibitors, PPIs, have been associated with acute interstitial nephritis, AI, which is a kidney condition that is characterized by inflammation in the gaps between the kidney tubules. This medication has become a common source of drug-induced AIIN in industrialized countries, despite the fact that only a very small percentage of people who take PPIs end up with arthritis. It is further troubling since the AI that is produced by PPIs frequently does not show any obvious indicators and frequently goes unnoticed. PPI use for a prolonged period of time may result in decreased renal function as well as abrupt severe kidney damage. Hypomagnesemia, often known as low magnesium levels in the blood, is a side effect of long-term usage of proton pump inhibitors, PPIs, that is frequently missed. Complicated kidney disease, CKD, is a condition that can develop over time. To put it another way, hypomagnesemia can throw off your electrolyte balance, which can lead to inflammation and ultimately lead to renal health problems. Muscle spasms, seizures, and abnormal heartbeats are just some of the major health issues that can be brought on by magnesium deficiency. The Journal of Pharmacotherapy published a cohort research in 2019 that looked into the effects that proton pump inhibitors, PPIs, have on kidney function. The purpose of this study was to investigate the relationship between the usage of proton pump inhibitors, PPIs, and the occurrence of acute kidney injury, also known as AKI, and chronic kidney disease in a large population. People who took proton pump inhibitors, PPIs, had a 4.35 times higher chance of developing AKI compared to those who did not take PPIs, according to the findings of a study that involved 93,335 individuals. PPIs were also associated with an increased incidence of chronic kidney disease, CKD. Researchers found that those who used proton pump inhibitors, PPIs, had a 1.2 times increased incidence of chronic kidney disease, CKD, compared to people who did not use PPIs. People who take proton pump inhibitors, PPIs, ought to undergo routine exams in order to assess their kidney function and magnesium levels. When all is said and done, you should avoid allowing the answer to one problem to become the cause of another. The use of proton pump inhibitors, PPIs, for an extended period of time can be harmful to your kidneys and lead to other complications, such as infections, fractures, or nutritional shortages. However, they can provide significant relief from acid-related difficulties. In order to alleviate acid-related disorders without increasing the risk of adverse consequences, it is essential to take proton pump inhibitors, PPIs, for the shortest amount of time possible. That is, 3 ACE inhibitors, angiotensin-converting enzyme, often known as ACE, and short-term inhibitors are 2 types of prescription medications that are frequently recommended to patients in order to reduce blood pressure and manage disorders that affect the kidneys, blood vessels, and heart. Lisinopril, which is commercialized, Zestril, Prinavil, Ramipril, which was discovered to have an LTS and a Labril in Vasotec, as well as Bonanza, Pril, and Lotensin, are most commonly used ACE inhibitors. These medications operate by inhibiting an enzyme that is responsible for the production of angiotensin II, which causes blood vessels to become constricted and leads to an increase in blood pressure. By preventing this enzyme from functioning, ACE inhibitors relax blood vessels, which in turn reduces blood pressure and the amount of stress that is placed on the heart. In most cases, ACE inhibitors result in an increase in blood flow to the kidneys, which in turn reduces the amount of work that is required of these kidney-shaped organs. The kidneys can be protected by this increased blood flow, particularly over the course of a longer period of time. Additionally, ACE inhibitors have the potential to assist in lowering the amount of protein that is present in the urine, which is a typical issue with chronic kidney disorders. In point of fact, ACE inhibitors are frequently suggested to patients who are suffering from kidney disease. Despite the fact that these medications offer protective benefits, there are hazards associated with using them. It is possible that your chance of developing AKI will increase if you combine them with non-steroidal anti-inflammatory drugs, NSAIDs, and diuretics. When you do not consume sufficient amounts of water to fulfill the requirements of your body. When you are taking ACE inhibitors, you may be at a greater risk of developing akeratosis, AKI. If you are concerned about your risk of developing AKI while taking these medications, it is advisable to discuss measures to reduce it with your physician. Concerns have been raised by certain individuals regarding the potential for ACE inhibitors to lower the estimated glomerular filtration rate, also known as eGFR. It is generally accepted that a greater eGFR indicates improved renal function. ACE inhibitors, on the other hand, lower eGFR by reducing the pressure that is placed on the kidneys. This makes it possible for the glomeruli, which are little filters, to relax. This may result in a minor decrease in eGFR. However, this does not suggest that there is a problem with the kidneys. Rather, it merely indicates that the kidneys are relaxing. The eGFR, on the other hand, may drop too much at times. Patients who are suffering from heart failure, chronic kidney disease, or blockage in both renal arteries or bilateral renal arteries are more at risk for this. If this happens, your physician may decide to temporarily discontinue the medication or alter your dosage in order to determine the origin of the problem. It is important to keep in mind that ACE inhibitors might cause acute renal failure in extremely rare instances, particularly in patients who are suffering from illnesses such as heart failure or severe dehydration. After discontinuing the medicine, however, the majority of patients recover without experiencing any long-term damage to their kidneys, even after requiring dialysis. ACE inhibitors are beneficial for individuals who suffer from heart failure, diabetes, or chronic kidney disease, CKD, because they reduce the amount of strain placed on the kidneys and provide protection for the kidneys over the long run. To counteract this, dosages should be carefully adjusted, and kidney function should be monitored on a regular basis when antiviral medications are being taken. Although antiviral medications are not required for the majority of viruses to clear up, they are given by medical professionals for the treatment of severe or chronic infectious disorders such as COVID-19, Ebola, influenza, genital herpes, hepatitis B and C, and HIV. These medications have the ability to eliminate the flu as well as other viruses from your body. Oseltamivir Tamiflu and Zanamivir Relenza are two antiviral medications that are commonly used to treat influenza. Antiviral medications, on the other hand, are not capable of entirely curing chronic diseases such as HIV, hepatitis, or herpes. Nonetheless, they can alleviate symptoms and lessen the severity of these infections. In the treatment of viral infections, antiviral medications offer a number of advantages. The fact that they have the potential to cause damage to the kidneys cannot be ignored. This risk, whether it involves direct poisoning or the accumulation of crystals that can lead to kidney stones, is a significant cause for concern. Particularly for individuals who already have kidney problems, it is essential to have patients under careful control and receive individualized treatment. Take, for instance, the medicine Remdesivir, which is intended for usage in the event of an emergency and is used in cases of COVID-19. A chemical known as SPCD is found in Remdesivir, and the kidneys are the primary organs responsible for its elimination from the body. Those who have kidney problems may experience an accumulation of SPCD, which can lead to kidney toxicity. It has been documented in a few clinical trials that Remdesivir causes a decline in renal function. However, the results have been inconsistent. On top of that, information obtained from databases all over the world revealed that Remdesivir was related with a much higher number of cases of acute kidney failure in comparison to other COVID-19 medications. However, there has not been sufficient clinical evidence collected on a significant scale to answer the question of whether or not Remdesivir is safe or hazardous for those who have kidney problems. For this reason, additional research is required in order to bring clarity in this area. In addition to Remdesivir, the use of antiviral medications that are more effective frequently results in acute renal injury that is caused by the drug. Sitafovir, Adafovir Foscarnet, a cycle of IR interfering, and Tenofovir are examples of antiviral medications that have the potential to directly cause cell death in kidney tubules. This can be accomplished by either decreasing blood flow or increasing toxins. Acute tubular necrosis is the diagnostic term for this illness. Furthermore, the antiviral medication Atazanavir has the potential to induce inflammation in the interstitial tissue of the kidneys, which disrupts the normal functioning of the kidneys. Moreover, a cycle of infrared radiation in the Navier and Foscarnet can lead to the accumulation of crystals in the kidneys, which can obstruct the tubules of the kidneys. On the other hand, certain antiviral medications, such as Vuredarade and Foscarnet, have the potential to assist in the management of kidney damage. However, they also carry a significant risk of renal failure. Therefore, it is essential to take these medications under the strict supervision of a medical professional in order to protect the kidneys. In addition, in order to utilize antiviral medications in a secure manner, you should never skip doses or use them inconsistently. Utilize them. This method can result in the virus adapting to the antiviral medication, which will reduce its effectiveness. We refer to this phenomenon as antiviral resistance. Also, keep in mind that antiviral medications may only be obtained with a doctor's prescription. Therefore, you should avoid purchasing them from unapproved sources or online. Lithium, for example, is a medicine that is available only with a doctor's prescription and is used to stabilize mood as well as treat some mental diseases. Mania, in which a person experiences feelings of great excitement, overactivity, or distraction. Bipolar disorder, which causes mood swings between extreme highs, also known as mania, and lows, often known as depression. And certain brand names of lithium or Primalcam Cullet Lisco, Numb, and Lead Liquid are among the mental health conditions that fall under this category. For more than 60 years, these medications have made a positive impact on the lives of a great number of people who are afflicted with bipolar disorder. It is impossible to disregard the influence that lithium has on the kidneys, despite the fact that it can be a lifeline for soothing mood. When lithium is used for an extended period of time, its use can result in a number of serious renal problems, including acute and chronic kidney disease, as well as kidney cysts. At the beginning of the process, kidney damage caused by lithium may be reversible, but as time passes, it may become irreversible. The most significant problem associated with the use of lithium is a form of diabetes known as nephrogenic diabetes insipidus, which is connected to kidney damage. Diabetes that is caused by excessive blood sugar is not the same as this type of diabetes. When you have this disorder, your kidneys are unable to respond appropriately to a hormone known as antidiuretic hormone, or ADH, which regulates the balance of fluids in your body. The end result is that one could have excessive thirst and an excessive number of trips to the bathroom. There are few instances in which prolonged usage of lithium can even result in end-stage renal disease, also known as ESRD. Symptoms of renal problems caused by lithium include increased urine output and thirst, frequent urination during the night, and signs of dehydration such as low blood pressure and a rapid heartbeat. In extreme circumstances, it has the potential to bring about alterations in mental status. Moreover, lithium has the potential to cause hyponatremia, which is a condition in which the kidneys discharge an excessive amount of sodium. In the absence of treatment, sudden hyponatremia, which occurs when sodium levels decrease rapidly in a period of less than 48 hours, can result in a variety of significant complications, including the breakdown of muscles, rhabdomyolysis, severe disorientation, seizures, coma, and sometimes even death. While taking lithium, patients should continue to consume a regular diet that contains an adequate amount of salt and water. Furthermore, when using lithium, it is essential to determine an appropriate dosage for the patient. Creatinine levels should be checked on a yearly basis by blood testing, and if anything seems off, you should seek medical attention. Lithium can be harmful to you in a variety of ways, not simply by acting on your kidneys. Therefore, before beginning it, you should inform your physician if you have any difficulties with your kidneys, heart, thyroid, or breathing, as well as if you have Addison's illness or Brugada syndrome. Additional safety precautions to take into account. Are you concerned that the medicine you are taking may be hurting the health of your kidneys? Therefore, it is essential to seek medical care as soon as possible. It's possible that the symptoms of renal failure won't be noticeable right away. However, when the situation continues to deteriorate, symptoms such as decreased urine output, edema in the legs, shortness of breath, and extreme exhaustion become more noticeable. In the event that treatment is not received, the effects may be fatal. If you want to know when to take action, let's make sure you recall these symptoms. In the event that you are currently taking any of the medications that have been described in this video, it is imperative that you perform regular testing to evaluate your kidney function. These tests should include blood creatinine levels, glomerular filtration rate, often known as GFR, and urine tests for protein. Your kidneys are able to remove toxins, salt, and urea from the body more effectively when you drink enough water. This can help reduce the negative effects of nephrotoxic medicines. Make sure you are aware of any potential interactions between your medications that could have an effect on the health of your kidneys. You should inform any healthcare professional who prescribes a new prescription about all of the medications you are currently taking. In order to treat a wide range of medical issues, drugs are, without a doubt, necessary. Certain medications, on the other hand, are associated with major dangers to renal health and should be utilized with caution, particularly in persons who already have kidney illness or who are genetically prone to developing kidney disease. Antibiotics, non-steroidal anti-inflammatory medicines, NSAIDs, diuretics, proton pump inhibitors, anticholinesterase, ACE inhibitors, antiviral treatments, and lithium are all substances that have the potential to impair kidney function. These impairments can occur through a variety of mechanisms, including direct toxicity, effects on renal blood flow, and electrolyte imbalances. It is essential for those who suffer from kidney disease to either abstain from using these medications or to carefully monitor their use. In order to select treatments that pose the least amount of risk to the kidneys, patients should collaborate closely with their healthcare practitioners. It is important to assess kidney function on a regular basis and adjust dosages as required. Keeping a healthy lifestyle can assist you in reducing the amount of medication you take. Your kidneys can be protected from any harm by consuming a diet that is well balanced and contains lean proteins, fruits, and vegetables, and by engaging in regular physical activity. Be sure to sign up for our newsletter if you are serious about gaining control of your kidney health and gaining an awareness of how the body functions properly. Ensure that you never miss a video that could save your life by clicking the bell symbol and turning on all notifications. It is our hope that you will also appreciate the video that is currently being displayed on the screen. Here is a list of the top 18 behaviors that could potentially be hazardous to your kidneys, along with some advice on how to avoid them. We'll see you there. If you love this video, please like and subscribe to the channel.